I am extremely frustrated, and this is something that frustrates me with the conventional medical system. So I am working with a new patient who has chronic low back pain. And so if you are somebody who suffers with chronic low back pain and you are struggling to find relief, your providers are not really giving you great options, or you may have even been told that your MRI is normal and that there's nothing that can be done, or you just need to go do physical therapy, or you just need to take some NSAIDs, or worst case scenario, you've been told that this is just all in your head, then this video is going to be for you. So I'm talking with a patient and they're telling me about their back pain. They've been struggling with this for about a year or so, and there are very particular activities that they are unable to do. Most of these activities are going to be flexion-based activities, which means that when they bend down, when they bend over, when they go to squat, when they go down to the ground, try to tie their shoe, try to touch their toes, do something like that, they get centralized low back pain. And now this back pain is debilitating enough that it has changed their life. It has resulted in them not being able to do the things that they want to do. And so obviously this is a problem. So the patient has seen other providers in the past, saw an orthopedic surgeon. Orthopedic surgeon obviously did not do a very thorough physical exam because, in part, it's insurance. They're doing stuff really quickly. They have to see a lot of patients in the day. And to the defense of the surgeon, if there are not big red flags that would mean that the patient needs surgery, then generally the surgeon isn't going to do a very thorough physical exam because they're going to refer off to physical therapy, where physical therapists are going to do those types of more in-depth physical exams. And so what happens here is the patient is now in this situation where they're told that there's nothing wrong on their MRI, which is what the surgeon said to them, and to just go do physical therapy. So patient goes, does physical therapy, doesn't really get better, but is now still left in this situation where told there's nothing wrong with your MRI and you just keep doing physical therapy. And so I'm talking with the patient and I say to the patient before I look at the imaging, I'm going to bet that you have something going on with your disc. And the reason for that is because they had a very classic pattern of pain that is worse bending forward, doesn't really hurt bending backwards, and the pain is central and it is deep. Those are the keywords that I'm looking for when I'm talking with patients that might key me into some form of disc injury. Usually that's looking like a degenerative disc disease, so some disc dehydration, or that's looking like an annular fissure, which is also called an annular tear. And so I say this to the patient, and patient says, the surgeon told me that there's nothing wrong with my MRI. And so I go, okay, well, let's just go take a look. And so what we do is we go take a look at the MRI. And so we're actually going to take a look here at this MRI. And so what we see here is we see sagittal cuts of the lumbosacral spine. So to orient people here, this side here is the back of the back. The abdomen is going to be over here. The head is going to be up here. And then the tailbone and feet are going to be down below here. As we scan through here, this type of sequence is called a T2 fat suppressed. And so what that means is that the signal for fluid is going to be very bright. And so here we can see the CSF fluid all through here. And then the signal for fat is going to be suppressed, which means it's going to be darker. We see back here that it is still a little brighter than the bones. However, the signal is going to be darker than the fluid. And so as we're scanning through here, so we're going to come down here to orient you. This here is the L4 vertebral body. This is the L5 vertebral body. This is S1 of the sacrum. That makes this the L4-5 disc. This the L5-S1 disc. And so we're going to take a look at the disc here. So in scanning through, relatively, we don't see any major herniations, nothing like that. The disc is relatively well contained. But as we start scrolling through and looking at this L5-S1 disc, we can actually notice that there is a little annular fissure that's right out here. So this part of the disc here has a small little tear in it. And I believe that this is causing the patient's pain based on everything that we've talked about so far. And so this is crucially important because this finding was actually in the report. The radiologist called this out appropriately as an annular fissure at L5-S1. If we come back and take a look at our images here and we come up, we can actually see that there is another annular fissure right here in the L1, L2 disc. So this little bright signal right here is an annular fissure. That's a small little tear in the outer annulus, which is the outer portion of the disc that's supposed to contain the nucleus pulposus, which is this brighter disc material in here. And this was also called out on the MRI. This could be a potential cause of the patient's pain. However, because his pain is felt much lower, this one here is most likely not painful. However, the one down here at L5-S1 most likely is painful. Both of these findings were in the report on the MRI, which means that if the surgeon looked at the report, the surgeon would have seen that. Sometimes the surgeons don't look at the reports, they just look at the images, so it is also possible that the surgeon missed these small little annular fissures. But regardless, the patient was told that your MRI is normal, and so he has proceeded along his pain journey with being told and thinking that there's nothing wrong structurally on his back. This is problematic because it has led him down a path of thinking that the discs are not problematic. Maybe the pain is just in his head. He just needs to do more physical therapy. This kind of constant thought process that like, hey, I don't know what's going on and I have to do something about it, but I don't know what to do about it. This is why it is so crucial to make sure that, one, that you as the patient are getting the reports and you're taking a look at these reports to see if there's anything written on these reports that may be contributing to your pain, and also advocating for yourself as you are going down this path on hey, let's take a look at my imaging again. Was there something that was missed? Let's talk to the radiologist. Let's talk to a new physician. There are a lot of things that can be done here. And so our approach here is we're going to plan on doing intradiscal PRP injection, high dose PRP, leukocyte rich, in order to try and help reduce the pain from this annular fissure. Now, it's important to understand that not all annular fissures are painful. You can have low back pain coming from a different structure, and you could still have an annular fissure and that annular fissure not be painful. So the presence of this annular fissure does not guarantee that we're going to have pain associated with it. What needs to happen here is a thorough in-depth physical exam where we're going to load the disc, we're going to put stress and strain through the disc. We're also going to load the facet joints, we're going to load the SI joint, we're going to load the supraspinous and interspinous ligaments, we're going to load the iliolumbar ligament. We are going to try to evaluate, is this patient's pain coming from this annular fissure right here, or is it coming from something else? If it is coming from this annular fissure, then our treatments need to be directed at that annular fissure, which in the orthobiologic world is going to be an intradiscal injection with high dose leukocyte rich PRP. If our physical exam shows that it's not coming from this annular fissure and that it is something else, such as the supraspinous or the interspinous ligaments, which can sometimes mimic a disc injury, then treatment needs to be appropriately directed at that. When we take a look here at the interspinous and the supraspinous ligaments on the MRI, we don't see a lot of edema within those spaces, and so it's less likely that it is the interspinous or supraspinous ligaments. But again, this still needs to be evaluated with a thorough, in-depth physical exam. So I'm frustrated because this is not the first time that we have had these issues where patients are told there's nothing wrong with your MRI, or even they're told you have an annular fissure, but that can't be causing your pain, and patients are left not having options for a treatment path forward. And so if you feel like this is your situation, I encourage you to continue exploring either with your current provider by asking more questions or by seeking out a new provider in order to evaluate the root cause of your pain that might have been missed on imaging.